Cool. So, Li Fei, you can take it away.
Yeah.
Okay. Good evening, ladies and gentlemen. Welcome to COVID-19 Impact on Asian North America Community ASI Awards Ceremony. My name is Qu Li Fei. I'm the president of Shandong University Toronto Alumni Association Council. Since January 2020, the outbreak of coronavirus disease COVID-19 has created a global health crisis that has a deep impact on the way we perceive our words and our everyday lives. It also has an impact and influence on our Asian community. By discussing with some of our alumni's children, they want to hear a response from our Asian youth about this pandemic. Also, they have set up an organization called ANAYA, the Asian North America Youth Association, to continue to help Asian youth to speak out their concern, thoughts, and response. This is the reason we wanted to host this ASI competition. We are very lucky to find 3 other Chinese community organizations to be hosts and sponsors. Finally, the ASI competition is hosted by the Shandong University Toronto Alumni Association, the Asian North American Youth Association, the Center for New Immigrant Wellbeing, the Brazilian Medical Development Association of Canada, and the Tianjin China Alliance of Canada. The co-hosts are the Tianjin Medical University Alumni in Canada, the Alliance of Canadian Chinese Engineers, the Education and Multicultural Alliance of Canada, and Canada Global Chinese Television. I would like to thank our sponsors, Brazilian Medical Development Association of Canada and the Center for New Immigrants Wellbeing, who respectively sponsor the rewards and other expense of these events. Their generous sponsorship promotes the attention of young Asians to the COVID-19 pandemic and impact on the Asian community. So please applaud and thank them. I would also like to thank our adults and young volunteer team. Most of the adult volunteers are made up of our alumni from Shandong University Toronto Alumni Association and a professional team from the Center for New Immigrants Wellbeing. Thanks to Professor Wang Peizhong, Mrs. Cao Ying for their rich volunteer organization experience and the professional judge team. Thank you to Dr. Eric and Dr. Zhou Yuan for their generous financial support. Thanks to our alumni volunteers, Xinqing, Yu Bing, Li Zhilan, Li Zhimei, Zhuge Xiangzuan, Ding Wenlong, and thanks our Alumni Association Council members for their strong support. Now, I hope you guys enjoy this wonderful evening. The Naya kids will continue the events from now on. I'd like to thank them for organizing tonight's events, and I will be handing over the reins to Ethan Jiang. Ethan, your turn.
Thank you very much, Li Fei. I would just like to welcome everybody and a brief introduction of myself. My name is Ethan Jiang. I am a third-year computer science student at the University of Waterloo, and I am very excited to be your host tonight. I hope you've all been safe and healthy these past few weeks. It is my utmost pleasure to welcome you all to this socially distanced webinar, where we will be presenting awards to the very talented youth who participated in our writing contest, as well as enjoying some talks by our distinguished guests. In total, 25 submissions from Canada and the United States in both Mandarin and English, one of which I can read, were recommended to the review committee. The topics were broad and interesting, from research proposals on how different countries dealt with the pandemic to personal accounts of how COVID-19 has impacted people's lives. We would like to take this opportunity to thank our contributors for taking the time to make your voice heard. So Jessica, I will leave it to you to introduce our organization.
Hi everyone, my name is Jessica, one of the founders for Asian North American Youth Association, or ANAYA. ANIA is an organization dedicated to supporting and encouraging the unique voices of young Asian Americans. We started ANIA because we saw many acts of discrimination against people of Asian descent in many different countries as the pandemic began to unfold across the world. For many of us young Asian Americans, this is also probably the first time we've experienced discrimination against our ethnicity. Like many of you, we felt strongly about this issue and wanted to do something about all the things we were seeing. We are also aware of the miscommunication between first and second generation Asian Americans regarding the many current social issues. We wanted to bridge this gap and increase understanding within the two generations. Founded by Asian American youths, we aim to provide a platform to foster discussion and thought on important issues within our community. We intend to empower young Asian Americans to speak up and share their valuable experiences and innovative ideas, especially during these times.
Thank you, Jessica. Now we can start our program for tonight. We are honored to have 3 distinguished speakers this evening. Dr. Lee Errett, President of our sponsor, the Bethune Medical Development Association of Canada, Dr. Pei-Zong Wang, President of our sponsor, the Center for New Immigrant Wellbeing, and our invited speaker, Leo Ding, recent graduate from Harvard Law School. Welcome, and thank you all for joining us this evening. And a special thank you to our sponsors for coming and supporting this webinar and writing contest, as well as the numerous other events of the Asian North American Youth Association. Our speakers will each say a few words, followed by a question and answering period for some of the submitted questions from social media. However, if you didn't get a chance to submit on social media, please place your questions in the chat and our speakers will answer them during the Q&A session. Please also make sure to write down which speaker you are posing the question to in the chat. And as well, please make sure you are on speaker view. You can change it at the top left corner of your screen, so you can look at our speakers and not look at my face for 2 hours. Please kindly mute yourself during the speakers' time.
Please kindly join me in welcoming our first speaker of the evening, Dr. Lee Errett. Dr. Errett has been well celebrated over the course of his career for advancing the Division of Cardiac Surgery at St. Michael's Hospital. His efforts have attracted a dynamic group of surgeons with excellence in research, innovation, and clinical care. He established an international fellowship program that trains 16 surgeons from 12 different countries across the world. As well, he is the first faculty member to be named as Chair and Professor of Global Surgery and will be devoting his full-time efforts to the enhancement of the program. He is also currently the President of the Bethune Medical Development Association of Canada. He also received the Ambassador Award from the People's Republic of China in October 2018 for his contributions between Canada and China. Thank you for taking the time to speak to us, Dr. Errett. Over to you.
Okay. Thank you very much for the introduction. It is a pleasure to speak this evening. I know a lot of you would have a lot of other things to do on a Saturday evening in August, but I'd like to go through some of my experiences. Obviously, I'm not Asian, and I'd like to go through my experiences of starting and developing the Bethune Medical Development Association and what it has meant to me and our group. Firstly, a lot of you know the name Steve Jobs. He was the fellow that started Apple. He started Apple, was very successful with the Macintosh computer, which is ancient now, I know, but he started that and then got fired from his own company he started. He got fired and then started the company called Next. Following that, he started Pixar, which is the greatest animation studio in the world. After that, he got rehired back at Apple, which is quite amazing. He said at the end of that the best thing that ever happened to him was that he got fired. He got fired because it kept him hungry and it kept him a bit foolish. It kept his energy up and it allowed him to look into new things that he never thought he would have explored without it. And that is what I think not to that level by any stretch. But when we started the Bethune Medical Organization, I had never been to China prior to that. And when you think of my generation in North America of traveling to China, and when I was your age, going to Florida was a very big deal, a very big deal. Going to Europe was a little beyond imaginable. But going to China, that was mythological. It was not going to happen. And now, when travel and communication is what it is completely different. Now, the world is our oyster, and it is for not only for me, but for everybody else. So when we had the idea of trying to go to China, it was out of our comfort zone. Didn't speak the language, obviously, didn't know the culture, and just knew that the medical care in China in parts was not the same as it was in the Western cultures. It was not the same. Sometimes it was better, sometimes it was not as good. And in rural China, Western medicine was less introduced than in big cities like Beijing or Shanghai. When we went there, our intent was to go to more rural China, parts of cities that were not known by, certainly by me, and most people in North America wouldn't know their names. And over the course of our time, we've gone to 160 centers, all different universities, and lots of different places. Of course, a small city in China can have 2 million people. So it's quite a different entity. The first place I went was Jinan in Shandong, and we visited Shandong University. So it's interesting to see the Shandong alumni being a co-sponsor with us tonight. When we went there, we first started off doing what I did, and that's cardiac surgery. Cardiac surgery was not as developed in most of China than it is what it was here at that time. So we went and started doing operations, and one of the things that was difficult was to get the idea across to the teachers that they shouldn't do all the work and let their underlings or their residents or their trainees watch. And that's the way it was in a lot of centers. There's one center in Shandong where the boss decided who to operate on, when to operate, and if he was not going to operate at all. And the other eight or 10 surgeons would never do an operation on their own, which was interesting because we didn't have that high a pyramid in Canada or North America. That is, the man at the top or the woman at the top makes all the decisions and does all the work. And I wanted to change that, not because he was doing anything wrong in his view, but to change that to allow a more horizontal rather than a vertical platform of advancing the cause for cardiac surgery in Jinan and Shandong and other places. So I didn't know the culture, and I didn't know Dr. Wong, this particular surgeon, very well. But I knew one thing, that he practiced Tai Chi every morning on the top of the mountain in Jinan. And I said, well, that's where I'll go. So I get up at 5:30 in the morning and joined him in Tai Chi. Now, I don't know anything about Tai Chi. So it was going out of my comfort zone to go there. And Dr. Wong did not speak any English. So I communicated with him, though, through an interpreter and through gestures, that I felt that his underlings, the people that he was going to leave a legacy to, would be better off if they were trained like him and they shared the workload. The idea there was that he would have a much greater legacy and much greater contribution to cardiac surgery and in Jinan and in Shandong province than other places. So he was encouraged by that. He was at an age where he was thinking of what he was going to leave. His legacy was important. And I tried to convince him that the legacy of teaching, of being able to teach, as Confucius had said many years ago, that was the golden opportunity to spread more knowledge. And that golden opportunity we were going to help with. We were going to help. How are we going to help? Well, we were going to design a program for the residents, for all his trainees, that they could pass at a staged level, staged sequence, reaching benchmarks, and being able to come to the level that he was at. And you have to understand, he had to have a certain amount of humility and ability to share his knowledge and his responsibilities to others. And that's exactly, though, what he did. He allowed us to help them develop programs that were westernized, but established in cardiac centers in the Western world. He did that, and we returned, and we made the promise we would return. Now, again, this is uncharted territory certainly for me, and it was for Dr. Wong too. But in order to make something like that happen, you have to have cooperation. And the cooperation was certainly there, and we learned a lot more as time went on. We developed this program, and it flourished. They were only doing about 130 operations a year when we started. When we finished a 5-year program, they were doing 800, and then 1,000. It multiplied dramatically. Along the way, we got support from the government, and the government was anxious to get the care upgraded and to treat more patients. And the idea of having to change the way you do things and change the way you look at how you do things had to be nurtured with all the people concerned, but particularly with one man. It went on that we were able to establish these sorts of centers in 11 different places. And at the same time, China was rising tremendously economically and socially in the uplift of people's welfare. And we got some notoriety over one single operation. When people recognized that Canadians were coming and doing operations, firstly, for free. We've never charged for any service we've ever done in China. And secondly, we're there to help all the surgeons learn our methods and the modern Western methods. So I was introduced to a patient, a very well-dressed, educated man. I could tell he could speak 3 languages right off the bat. And he was welcoming our operating on him. So I didn't know who he was, but I knew that when we did the operation, there were all kinds of movie cameras around. And I thought, well, this is being transferred to another auditorium or a classroom where other students were watching. But that wasn't the case. It was actually being broadcast. And knowing that up to 75 million people would be watching your operation makes your hands a little more shaky than they would be, as you can imagine. But that allowed us a little more notoriety. So we were doing cardiac surgery, and then we decided to expand it to anesthesia because we needed anesthesia to do the operations. And we also wanted cardiologists to be involved. So we improved cardiologists. And we included, next step, people in the intensive care, nurses from the intensive care. And then we recognized that all specialties needed to be represented. Hematology, orthopedics, neurosurgery, and we gradually increased the number of people we were going to bring. What happened is we expanded pretty dramatically. We had 3 members in 2010. We had been doing this since 1998, by the way. And we had 3 members of our group. A lot of people had joined us, but we hadn't organized. We hadn't organized into a group that was that could be identified as a participants in the Bethune. So we decided to name it the Bethune Medical Development Association, and that was with Yuan and David Dye and myself. So we started off with 3 members. Now we have 400 members in China, Canada, Australia, United States, and England. And they all have the purpose of improving the lot of medical care in China. And we also thought that the Chinese students who wanted to come here could do so. And we've had over 120 students come to the University of Toronto, McGill, McMaster to train, but beyond that, to learn our ways. And they've all, I've heard from a lot of them, they've been incredibly appreciative. And we've gained some significant friendships. In Jinan, there was one particular doctor who wanted to come to Canada, and the Dr. Wong I spoke to about earlier wanted to earmark him as being the new professor. So he was sending him to train with me. Now he got here to Canada, and he was given for a year $12,000 to live on. Now, most of you recognize that $12,000 in Toronto to gain accommodation and food is not enough. So he came to live with me in my home. And we actually became good friends. And he learned a lot in Canada while I was here, and went back and did exactly what was intended. He became the chief in Jinan, Shandong province. Others came, and we developed this without knowing where we were going in the first part, but slowly developing. One of the issues in China, when we were asked by the Ministry of Health, what is the one thing that could change China's healthcare in your mind? And I said the one thing that you could do is give everybody insurance. So everybody could have the privilege and I thought the right to get medical care when they needed it. Well, there was a committee I was talking to, and they said, no, we can't afford that. I said, well, how about giving the health care to the farmers? The farmers are necessary, and up to 35 million farmers were coming in from the farms to the cities every year. Amazing. The population of Canada was coming from farming, and they were doing that for economic reasons, but they're also doing it for healthcare. So my proposal was to give farmers healthcare. If you can't afford it for the whole population, give it to the farmers so they would stay on the farm. Because you've got to feed 1.3, 1.4 billion people. And you're going to have to do that with their help. So they did that. ultimately they did that. That was back in 2008. And that changed the healthcare in the communities. It changed the healthcare for the farmers for sure. And it propelled more insurance and more coverage for the whole of China. That was not in my comfort zone. It was way out. But it was easily recognizable as a very important thing. And coming from Canada, where we expect healthcare and we anticipate that we'll get it when we need it, that would change the lot of the Chinese significantly. Now, we've had tremendous opportunities in China. We've been all over, and China is a magnificent country that has just as much geography difference as Canada does. Has places where it snows, places where it looks like Hawaii, and everything in between. So we've had that opportunity to go to a lot of different places and develop close relationships with the Chinese. And we have a vision of expanding that further so there's cooperation between us and China. And students, that eventually our students can go to China and learn just like they're coming to us. And that shared cooperation has to go without prejudice, without racial, and as a matter of fact, without looking at political situations. Because I have not been aware, and I'm not naive about it, but I've not been aware of any problems politically that we've had. All the doctors have been helpful, the administrators have been helpful, we've been treated with respect and tremendous hospitality. And that encourages us to go back. Had we been treated badly, there's lots of other places we can go to, and we would. But that has not been the case. And that's illustrated by what I'm going to say finally. And that is, we traveled to Wuhan a number of times. And we knew the hospitals there, and we obviously knew the people there. And when the end of February and the 1st of March, it was significantly ravaged with COVID. 50,000 cases were in COVID on March 1st. There were 4 cases in Ontario. Along with my colleagues in the Bethune Medical Development Association, we thought we had to do something. Even though it would be a small gesture, we had to do something to show that our organization wants to support China, and particularly Wuhan, in the tremendous time of need. So I wrote a letter that we put on WeChat asking for contributions. In 4 days, we got $250,000 worth of contribution. Then we decided, what are we going to buy? I mean, all the PPE is actually made in China, that we get, at least a lot of it. So $100,000 went to buy PPE to ship to Wuhan hospitals. And we asked them what they needed, what they wanted, which was a device that we use seldomly in Canada. And that's an ECMO device. That stands for extracorporeal membrane oxygenation. What that is basically an artificial lung. And it helps people with lung disease recover by doing the work of the lung while the body recovers. It had extensive use in China during the H1N1 in 2009. And the Chinese have more experience than we do for that purpose. So we contacted the companies here, and they just happened to have 3 demonstrator machines that were brand new, very well maintained, and they'd give them to us for half price. We purchased them, and then Hainan Airlines stepped up and said they'd ship them to China for free. Otherwise, we were going to pay $16,000 for shipping. So everything fell into place. by March 15th, we had the PPE and the artificial lungs, the ECMO devices, all in Wuhan, one for each of the major hospitals in Wuhan. And they were using the machines almost on a daily basis. And lots of different studies have been done. Some saying they've saved—
I'm not listening, okay? I'm not practicing my English.
50%, and others a lesser amount, but certainly had they not been used, those patients would have died. So that was a significant— we were very proud of that and happy to do it. But then something unique happened. We sent in total $250,000 worth of equipment. What happened then was the Chinese started sending stuff our way, because the tables had been turned and COVID was beginning to affect Canada in a much more virulent and vicious way. We got, in total with all the organizations, $2.3 million worth of equipment, PPE and equipment, which we distributed to hospitals, the nursing homes, and all the University of Toronto, some at McMaster, and all the places where we had workers that reached out to us that needed the supplies desperately. So that kind of relationship, I think, only comes with trust, and it comes from going from beyond your comfort zone. It goes beyond your comfort zone to go into places and do things that you wouldn't normally do, and going to places and setting up shop where you wouldn't, and welcoming yourself to going to do it. You have to have a little bit of moxie to do it. You have to have a little bit of courage to do it, and the will to help other people. And I think by virtue of our experience lately, the relationship with the Bethune Medical Development Association of Canada and the people of China, well, the bond has only gotten stronger, and we look forward with new visions to look how we can go beyond what our comfort zone is, to be friends, cooperative, and colleagues. We do things for three reasons. We provide service, we provide education, and we want to leave something sustainable behind. And sometimes the sustainability is based on friendship. And I think the experiences we've had with the Bethune Medical Development and going beyond our comfort zone has been one of the best experiences of our medical careers. And I'd like to end there, and if there's any questions, I'd be glad to answer.
Thank you, Dr. Ehret. Now, please warmly welcome our second speaker of the evening, Dr. Wang. He is a tenured professor in the Division of Community Health and Humanities, a crossly appointed professor in clinical epidemiology at the Faculty of Medicine at Memorial University of Newfoundland, and a senior scientist at BHCRI. He graduated in medicine from Tianjin Medical University in China and received his PhD in epidemiology from the Dalai Lama School of Public Health at the University of Toronto. Thank you for taking the time to speak to us, Dr. Wang.
Okay, thank you. Can you allow me to share my PowerPoint slides? Yeah, okay, I can share. Good. Okay. First, I want to thank you, President Chu. So I just heard Lee's talk, and very, sorry, I'm down here. Okay, thank you. Lee, your speech deeply touched me. We have known each other for probably 1 year. So some story is the first time I heard. I want to salute to you for the great contribution you have made to the Canadian, to Chinese, and as you develop an association in the past many years, has acted as a bridge between China and Canada. Particularly, we are in the special time. We all know the relationship between the countries, and is not as good as we wanted. I believe in this situation, our organization would play a very important role to promote this relationship. So back to my topic, I prepared a number of slides. Initially, I thought I only need 2 hours to finish my slide, but end up I used a much longer time. But even though I still could not finish, so I just did what I could. So the topic I'm talking about is the pandemic, the COVID-19 pandemic and the impact in the Canadian Chinese community. Let me see, I can share this with you. Okay, good. So this is my presentation outline. I'm going to talk about 3 things. First, I talk about the ongoing COVID-19 project, which is funded by the Canadian Institute of Health Research, CIHR, through New Frontiers in Research Fund. So I hope I can use 20 minutes, less than 20 minutes. I know that I do not want to go beyond time. And the second part, I briefly talk about the products, the articles, the proposals we received. And I leave some time, probably less than 10 minutes. I'm going to respond selected questions. The questions are pre-selected. I already got 10 or even more than that. I don't have enough time. I only use a few minutes to go through that. So I'll begin with the project. The project, we have a team, number of Chinese scholars, and myself as PI, Dr. Li Xiaoyang, who is a professor of psychology at Ryerson University, and Dr. Wei Guozhang, who is professor of sociology, University of Toronto, Dr. Xiaolin Wei, who is professor at Dalai Lama School of Public Health, 4 of us. But I have to say, ever since we received this grant, and because this grant needs to be conducted in the Chinese community, we reach out to many Chinese organizations, and we received strong support. As a result, we were able to set up a steering committee. Here are the names. Probably some of them, maybe here, because I did not send my invitation early enough. So because of them, we regularly had meetings and we regularly receive input from them. And this is supposed to be a 2-year research project. So far, we have passed probably 7 months. So we still have a long way to go. By the end of the year, we need to have a retreat. We need to think about what will they do for the next year. And this is the thing. In addition to the steering committee, and we also received strong support from a number of organizations. And Norman Bastion Development Association is one of them here, only listed in Chinese name. And so this is this. So before I talk about my research, I just very quickly go through the timeline in terms of COVID-19. I mean, major events, timeline. The first reported human-to-human transmission in China was on January 20th. And the first case in GTA is a passenger who flying from Guangzhou to Toronto, and he got sick in the airplane. He was transferred to Sunnybrook. In January 24th, COVID-19 Canada would officially became reportable infectious disease. That means when physician finds the disease, you must report. Air Canada canceled all flight. I just very quickly go through this. The relevant event, school closure announcement. School closure in Ontario, March 12th. Yeah, school closure. And let me see. So jump to this. Face mask advice change. So you may recall before that, the advice we received from public health officials, they are telling people, they say you don't need to wear the mask. The mask only protecting you, infecting other people. mask does not protect yourself getting infected. Here now we think illogical argument somehow, but at that time we practiced this way. In fact, one of students' questions was asked this. And to May 4th, we have opening plan. So, very few months, the events evolve so fast, so quickly. So what is the current situation in Canada? Let me see. Again, I need to use this. So this is yesterday's number. I believe this information is easily available. You can get it very quickly. This is overall the number. You can see it's by the distribution. It's the two most affected provinces are Quebec and Ontario. In Canada, the number of cases, 130, roughly 130,000 cases. So if we look at the curve, epidemic curve, so the peak occurred in roughly in May, early May, and in April, May is peak, and we see sharp decline here, but now this curve looks like plateaued, even slightly going up. So this is, many people predict, probably we are going to have second wave. Really depend how we are going to define second wave. My judgment, really judgment, now I don't have this, nobody has solid evidence or support to make the predictions. Very likely, we are going to have second wave. If not second wave, probably have a rebound. Anyhow, it's winter time, people like to stay home more, spend more time, and also, we have gone through such a long period, and people get tired of this. They want to get together. Even online interactions, very convenient, but still cannot replace human-to-human, face-to-face interactions. So talking about my research, the research proposal had 3 objectives. The first one is to assess Canadian Chinese immigrants or Canadian Chinese population, their knowledge, attitudes, belief, and the protection procedures. So this study was conducted in April. At that time was the peak of pandemic. The knowledge, the research in the area is very important and going to help us better prepare us for the possible second wave. Second objectives, we are going to evaluate and develop mutual support self-quarantine network. The pandemic, the first started in Wuhan, and shortly afterwards, this is spread to the other part of the world. But in Canada, the first important cases were from China. At that time, Chinese communities are very nervous, and they did their best try to stop this disease to spread in Canada for 2 main reasons. Firstly, we do not have the pandemic. And second, the starting in Wuhan, many Chinese people, including me, have some kind of strong connections and also have some kind of certain stigma. If this is starting in China, we are Chinese people, we should do our best. Otherwise, going to ruin our reputation. We do not want to, if something happens in Canada, we do not want to be the source of the pandemic outbreak in Canada. So for this reason, so we had a strong group, strong network, people helping each other. So we did very well. This is we want to study this, examine this, we try to disseminate our knowledge to help other communities. This is the second objective. The third one is to assess the psychological impact of COVID-19 outbreak in Canada and also identify associated predictors. This. And 3 things. So I don't have enough time to go through this in too much detail. Here I want to say, so far what we have done. First, we completed data collection for study objective 1. This was online survey, starting point is April 2nd. Very quickly collect information, very short time period, we collected information from roughly 800 people. Mainly through online. At that time, online was the only possible means possible way for us to collect information. And shortly after that, we all conducted another survey, collected data, and on objective 3, basically, this is assess psychological impact of COVID-19 on Chinese immigrant. And in addition, there's 2 surveys. We also interviewed, personal interview, 60 people. Each interview roughly takes 1 hour. Yes, it's a lots of work. So we stratified this group of people, we make it balanced, males, females, young people, older people. In the meantime, we organized, co-organized many public Zoom forums and workshops. We presented our research results in several national and international venues. And there are a number of manuscripts is being prepared. Hopefully before long, we are able to send the manuscript out for publication in peer-reviewed journals. This is so I just very briefly use a number of this few slides to show the major findings, major results. First one, the overall Chinese Canadians are highly aware of COVID-19 protection, COVID-19, and actually take preventive measures to prevent this disease. So this probably is too small font. This is basically asks participant each item, whether you wear mask, whether you go out to use a sanitizer, you can see this kind of detailed things. There are 22 items. Overall, they did very well. And there's some word is negatively worded, question is negatively worded, some positively worded. In general, it's pretty good, but we still have some problem. For example, A1, you can see, cover your mouth with bare hands when you sneeze and cough. This is not correct. This is correct, but people, still do that. So this is a message we need to send out. And also we found out men more likely to use their bare hands, the hand to cover the mouth. This is the main thing. We also ask the opinions. And some encouraging things, some not so encouraging. And apparently, for example, if we say the K1, this question, source of COVID-19. So at this moment, we don't know precisely where COVID-19 come from. This is not a science, this is our opinion. And 40%, around 70%, 0.8% people believe from wild animals. Yeah, and from high biotech lab, 36, very high. That means among Chinese people, there are more than 1/3 of people believe the virus is from the lab. And even go to very wild, and 6% of people believe this biological weapon made from in China, US, whatsoever. This is conspiracy theory, something. So I don't have time to go through too much information. And if you are interested, I'm happy to send the detailed information to you. Yeah. So this is already show this. This slide shows the information. We already sent this to an international conference, American College of Epidemiology, which will take place on September 20th something. Let's talk about the information source. During the peak of the pandemic, information is important. Reliable, trustworthy information is crucial. And people at that time scrambling with information. And the bottom line is only 14% respondent felt they have enough information. They don't need more information. But that means the majority of people need information. This is important. During the pandemic, information and reliable information is very important. So the second point, talking about COVID-19, the major impact on Canadians. In fact, the impact can be measured in many ways. In this survey, measures the financial impact, family impact, job impact, and here I only show a very small part of this psychological impact. So this is another abstract that was sent to American College of Epidemiology. Only take one sentence from this long abstract. So final sample size 700 something responded answered. Roughly half of the participant had some kind of psychological impact, felt like psychological impact. So yeah, in fact, I already talked about it, placing in the wrong place. This one is very interesting. Yeah, traditional Chinese medicine. Traditional Chinese, we all know, traditional Chinese medicine is a part of Chinese culture. Is in China, it has been practiced for more than 2,000 years. And on top of that, the TCM has played important role, still they play the important role in preventing, in curing COVID-19 in mainland China. At that time, we just wanted to know in the Chinese population in Toronto, how many of them believe them, how many of them practice them, use this Chinese herb to prevent this disease. So again, with this abstract was sent to ACE. This abstract was accepted. So the main message, almost half of study participants believe Chinese traditional medicine can effectively prevent COVID-19. And on top of that, 46% would use Chinese traditional medicine. So the interesting word is like this: if you suspect you are being infected, would you use traditional Chinese medicine? So 46.1% participants answered yes. So this is very different. So the bottom line is, given the fact the Chinese medicine is widely used, but so far we don't have solid scientific evidence. This is urgent need. Doing some research whether the traditional Chinese medicine indeed played a role in preventing this, and whether this Chinese traditional medicine can be effective measure prevent the future infection. This is very important. So far, we have limited knowledge on this. So this is another interesting, also sensitive topic. A number of students wrote their essay on basic authority. Perceived and experienced racism is prevalent in the survey. In this survey, we asked two questions. One question, worded like this: do you believe Chinese people in Canada being discriminated against because of COVID-19? The second question, it was worded like this: have you personally experienced racism or the discrimination? So the first answer is almost half of the people, and the second answer is 11%. 11% is very high, in fact. If you conduct a survey today, the percentage would be much higher. The reason is we use prevalence. We use cumulative prevalence. If you ever had this, at that time, the pandemic just started, very short time period. As time goes, several more people have this same experience. So I would not be surprised if we conduct survey and we're going to have a double, even triple this number. So this is another one. And we also asked another interesting question. Ask participants to read the Canadian government's response. But generally speaking, Chinese Canadians are very satisfied with the Canadian government's measures to control COVID-19. This is roughly my talk. So I don't think probably I will use enough time. I talk about the COVID-19 on the context. I have to say, I have read every single one. I feel I learned a lot from you. I learned a lot. So you know, this is a very good platform, and I can, from my reading, I can sense your deeper feeling, your dedication, your compassion, your courage, all demonstrated on your work. So, you know, I don't have time to share all of them, but I just pick up a few. I leave this for you to read. COVID-19 is a bad thing. And people often think of negative, this bad, that bad, but many of them, you guys, can think of this in the positive aspect. So this is one thing. This is one. This is another one. Talk about personal experience. Yeah, talking about it before COVID-19 and during the period COVID-19. Yeah.
Okay,
so I still have a few minutes. I received a number of questions. I selected some of them, very few of them. The question number one, how does the COVID-19 pandemic compare with the previous pandemic? Similarities and the difference in viral behavior or something. This is quite, when I read this question, I found two pieces. Yeah, your writings very interesting. This is the first one, 12 disease that changed our world. This is book. I have this collection. I purchased 3 copies. I sent 2 copies to my students. And this is online article talking about how 5 in the history's worst pandemic finally ended. So I'm talking about that. To my knowledge, as a major in the past, a major pandemic, I would say is the 6 that are directly relevant to us, and also major ones. The first is plagues. So this one is 500 BC, killing estimate 30 to 50 million people. At that time, around half of the world population. At that time. The second time, same pathogen. This is not a virus, you know. This is bacteria. Black Death came back in 40 years time period in Europe. I believe 20 million or probably 200 million is too many. Probably my typo. And anyhow, it's a huge number of people that died. And this disease, this bacteria stayed with us for a very long period. There's another third, we call the Great Plague of London. So lasted roughly 300 years, killing about 20% of London population. So the question is whether which pandemic has the biggest impact really depends on how you measure it. In the old days, we talk about number of people deaths, but nowadays there are beyond the death is only just one aspect. There's so many different things. Another pandemic, smallpox, started to this pandemic in Europe, in Asia time, but in North America, the indigenous people did not have the disease. When people from Europe, you made it in North America, they brought this disease with them. They came to North America, and as a result, roughly 90 to 95% of indigenous population were wiped out. That's a huge, as you can see. Another one is cholera. Cholera is, again, it's not a virus, it's a bacteria. Cholera still around us. Whenever we heard from the Haiti or the developing countries, if we have natural flooding or disasters, the cholera is very prevalent. In the world, in the history, cholera killed many people. And also, cholera also provided opportunities. to us. And the current public hygiene, public I would say they use this word. The current public health, it was from cholera prevention in 19th century from UK, and because people think about prevent this, and this gave the birth to the current, as we know, the public health in the world. And the last, the number 6, Spanish flu. In fact, the Spanish flu, the name is sounds strange. People would think of this flu from Spain, in fact, from the United States. United States, at that time, during the First World War, US soldiers went to Europe. They brought this virus with them. As a result, when the First World War ended, and the soldiers went back to their own place, as a result, a big pandemic. And at that time, killed 30 million people in the world. It's big, yeah. So this is the first question. Second, as a researcher, how do you decide what research project to work on next? I know I have 2 parts on here. In terms of some researchers, I would say number of factors you think about. To be practical, need to have funding to do the research. For sure you need to identify important topic. And for myself, I'm very lucky to receive the funding, and also this funding provided us an opportunity to conduct research in Chinese community. And to me, I would think, first, do you think the topic is important? And second, is select something you like. You have strong desire to do that. And the third thing you need to think about, you need to have capacity. I mean, resources, financial resources, other resources, the main 3 factors. In terms of for what I'm going to do, as mentioned, we already carried the first stage of this study. At the end of this year, we are going to communicate with community leaders, with general Chinese people in Toronto, and to collect input. And we also would like to collect input from you. If you think this is something need to be conducted, it needs to be researched, just simply let us know. And your input is very important for our future work. So the third question, which country have been hit the hardest, aside from just numbers? It's very interesting, also very important topic. Very important question. People talking numbers in each country. Countries vary by size. Some countries like China, we have 1.4 billion people. Some countries very small, only have 1 million or 2 million. It's very small. So the true number sometimes can be misleading. So here I made some slide myself. You can see how to interpret the information. I list the top 10 countries in terms of total cases. First is US, right? Followed Brazil, India, Russia, Peru as well. You can see this number of cases. The varies by the countries vary by size. US has large population, roughly 300 million people, and some other people for Chile is much smaller. So the 2 numbers cannot directly compared. So another way to look at the death. Death is a much reliable measure. If you only count new cases depends on the incidence and also depends on the testing. If in the developing countries they don't have some kind of COVID-19 testing capacity, they are not able to find the new cases. But often, if a person gets very sick, they would have opportunity to be diagnosed. If this person dies, they're more likely to be counted. So death is a much reliable measure than new cases. But still not enough. In epidemiology, we have another measure we call incidence. Incidence can be a person-time incidence. In this case, I call it cumulative incidence. So starting from the beginning point and to the current time, overall, how many new cases per 1,000 people, 1,000 individuals. So if you counting this, the population size for each country, does not play a role because we count per 1,000 people. As a result, the country who has the highest incidence, Qatar. So this very small country, if you count the overall number of cases, you would miss. But given the fact, the US, regardless how you count, still on the top 10, is number nine. Then in the United States, 18 per 1,000 people is a huge number. You have among 100 people, is roughly the 2 people, had infection, either had or have the infection. So another way to measure, we talk the population mortality rate. So talking about the eventual result, eventual number of deaths, not just the new cases, talking about per 1 million people, how many people died from this disease. Again, the population size does not affect the calculation, and small countries tend to have, but US again on the top 10 is very high, and you can see 1 million people have 562 deaths. You can make math. You can directly translate how many deaths. So sometimes you think about if you divide it by population, probably does not make too much sense because some people don't have the disease. The logical way, we compare the people with disease and calculate the deaths, number of deaths among the people who have this condition. We call it case fatality rate. Among cases, how many of them die? So this is top 10 countries. Some European countries are very high. This time, US is not on top 10. If I remember correctly, US is on top 11. So just slightly off the 10. So question 4, do you think the world will ever go back to normal? If so, how long do you think it's going to take? We just discussed this question before. According to WHO, no one knows, I can tell you, no one knows this for sure. How soon we are going to be back to normal. And you understand, normal we call the quotation mark, normal will be changed. So it's going to take, but I can assure you, we will go back to normal. This pandemic, like all the pandemic human being has experienced before, will end. If not 2 years and probably 3 years, anyhow going to end. So we need to look at the bright side on that. And the thing is, we already survived almost 7 months or 8 months. So we still need to continue to be persistent, to need to be cautious, to need to be vigilant. If we are determined to fight this disease, and probably we can make this pandemic will end sooner. So this is my judgment. I think this is going to end. So I believe I only selected these 4 questions, and we still have QA. I believe I go beyond my time. So I would stop here. Thank you very much for your attention.
Thank you, Dr. Wang and Dr. Ehret, for your inspiring and educational speeches. We'll be answering everyone's questions at the end after all the speakers have spoken. So now please welcome our next invited speaker, Leo Ding, a graduate of Cornell University and Harvard Law School. Prior to law school, he worked as a management consultant with a focus on asset management and private banking. Within the legal world, he has experience in the labor division of the UN, criminal prosecution in California, and mergers and acquisitions at a New York law firm. He currently serves as a law clerk to the Honorable Judge Michael Garcia of the New York Court of Appeals. And Leo grew up in North York and still calls Toronto his home. He will be speaking about how law and policy shape the US pandemic response. Thank you for taking the time to speak with us, Leo.
Hi, everyone. Thank you so much for inviting me to speak on a topic that is both, very important and very immediate. It's, a pleasure to be here. I'm here to talk a little bit about the US law and policy response, and specifically how that's shaped not only domestically how we've dealt with this pandemic, but also how we've promoted our response to the rest of the world. I wish that I could have as positive and hopeful of a story as Dr. Everett's on cooperation with China and Dr. Wang's on the Canadian response, but spoiler, we don't really have that here at the moment. We are still going through the worst of it, but it's starting to look up and starting to look a little better. Just by way of introduction, I am currently working at the Court of Appeals in New York, which is the New York High Court. So I work with my judge to both discuss cases and decide cases. The court system here has been shut down for the past 5-6 months. We are just opening back up for oral arguments in September, which is both exciting and a little bit scary because of the current situation. So my experience in the law has been fairly brief. I graduated very recently, but having been able to see a lot of this firsthand has really provided a perspective that I didn't quite have back when I was, in the working world and back when I was in Canada. I immigrated to Canada in '99 and came to the US about a decade later. So I've been here about half of my life now. And, when I first came to the States, I thought I was going to a place that was fairly similar to Canada. A lot of superficial differences, we like hockey and they like football here. We drink a lot of Tim Hortons and they have vastly inferior brands of coffee. But after being here for a little bit, I really started to see more fundamental differences that shaped how its legal response has been. And that's kind of what I wanted to share with everyone. And I think to start, one of the most jarring differences is really in how the fundamental structure of the government is here. And you can kind of see that in the name of the country, actually, the United States of America. Growing up, we called it in Chinese like 美国, and I always thought that translated to the America part of the name. But here, it's really the United States that's the most important. Without going into the history of the country, I do want to highlight that the country was formed in 1776 with 13 colonies, and it was really the states that stood out and not the United States as an overall federal government. And that has had a lot of consequences for the virus response here, because the way the Constitution has shaped the country gave most of the power to the states and not to the federal government. You kind of have to think of it as representatives from these 13 colonies coming together and deciding what is best for people of our states, citizens of New York, Pennsylvania, New Jersey, and not so much who we are together as the United States. So they gave a limited and enumerated constitutional powers to the federal government. That's important. I'm not going to dive into the Constitution on a Saturday night for everyone. I don't want to bore you with that, but the amendments gave the states the right to respond to everything from police powers to legislation to criminal law. You see that in how differently the states legislate things like marijuana, things like capital punishment, same-sex marriage before it was legalized nationally. And so on the response to the coronavirus, the decision-making power was given to the governors of each individual state. That's something that's quite unimaginable in a lot of other parts of the world, because you have 50 states, which means there's 50 decision makers, each supported by their own senates, their own cabinets, trying to come up with a decision that is the best for their people. And those decisions vary tremendously. You've probably seen that the governor of Michigan, Governor Whitmer, shut down her state almost immediately, and she faced very fierce resistance to that. You might have seen photos in the papers where armed civilians occupied the Capitol building of Michigan State and protested her lockdown measures for the entire state. But they recovered very, very quickly. Whereas New York is somewhere more in the middle. They had a moderate response. And a lot of people gave Governor Cuomo a lot of criticisms because as a result of the slower response, New York peaked in April with tens of thousands of new cases. And the entire city of New York City was ground to a halt. New York State eventually shut down and has recovered since. On the far end of the spectrum, you see states like Florida. Governor DeSantis of Florida is unfortunately an alum of Harvard Law School, so he is one of my peers. And he has the slowest response, almost a non-response to the virus. And that's why you've seen Florida in July, it's 10,000 new cases a day. Those numbers are unheard of outside of Florida at that time. And at the height of their spread of the virus, in July, the governor permitted not only celebrations to go down on Independence Day for the 4th of July, but also Disney World opened to the public on July 9th. That's probably one of the most concentrated and densest parks in the world. And they opened that to families, to visitors to the States at the peak of their pandemic. So, across the country, there was very uncoordinated treatment of this disease. It varied in testing, it varied in lockdown measures, it varied in the support that they gave to their hospitals, to how fast they closed or opened schools. And all of that comes from the different powers given to these state governors and state legislatures to determine the best path forward for their own citizens. And at an even smaller, municipal level, mayors actually have tremendous power in what their city does. And oftentimes they're not overruled by state governments or the federal government. You might have seen interviews with the Las Vegas mayor saying that she's happy to open casinos and hotels back in June and serve as a testing ground for how fast a city can open up in the middle of the pandemic. All of that combined has really given a lot of space to people who are, in my personal opinion, very extreme holders of libertarian values, taking it to an extreme that the individual right to absolute freedom goes beyond any control of the government to any measures or regulations that they might possibly put into place. That has given rise to a lot of the anti-mask protests that is becoming commonplace in the United States and accepted into mainstream narratives, mainstream debates. I imagine that must be incredibly frustrating for healthcare workers working on the front line, putting their lives at risk to deal with this pandemic, and at the same time seeing the very people that they're trying to protect spew a lot of this nonsense grounded in absolutely no science and simply in personal freedoms and liberty. In this society that really doesn't give much to communal dialogue or communal support for the people in our society that are most at risk. And the role of race and class in this debate and dialogue has become very apparent. I think as Asian Americans, this virus having spawned originally in China did bring a lot of xenophobia into the open, into the public. People might have held either racist or xenophobic views before, but now that they have something to blame it on, and given the lack of a coordinated response and a coordinated message from the federal level, it's really given these, what used to be fringe positions, fringe opinions, they've been elevated to the national stage and are able to put that out there, really adding to the misinformation that has has grown from a very local level now onto the national stage. The split in responses in particular have taken over different parts of social media. And that's something that I also wanted to address, because the debate of whether masks are good or bad is almost non-existent in the medical community, but is really, really much flourishing online in corners of Facebook, of Twitter. The misinformation is protected in much parts of those platforms. People think by the First Amendment free speech, but free speech really only applies to government actions. So these platforms are able to control what is published on them, but they don't have to, because sites like Twitter and sites like Facebook that we all use are not publishers' information, they're platforms. And as a result of that status, they don't have to moderate what goes on. Mark Zuckerberg has gotten a lot of criticism for not forcing Facebook to actually go through the content of what's posted, whereas Twitter has taken a stronger stance and said that we're going to flag your post if it doesn't align with what the medical community has said. So recently they've even flagged President Trump's tweets and labeled that as misinformation because of that. As a result of all of this, the lack of coordinated effort and really the freedom to say what you want, the conspiracy theories that have spawned in the US, I think, are extremely scary. If you spend a lot of time online and you follow some of these stories, it's actually really disheartening. There's theories that the virus is a result of the implementation of the new 5G phone network. There's theories that the Democrats are trying to steal the election in November and really upplaying and upselling the impact of the virus to show how the Trump administration has failed to deal with it. There's a lot of religious discussions, and people might be of different faiths, but holding religious opinions as an absolute truth and ignoring the medical community, I think that certainly has very significant ramifications. We see that now, coming offline into the real world, where people are, feel empowered online. So there's communities that have printed fake medical cards that say that they're exempt from social distancing or exempt from wearing masks. All fueled by information that is online. So there's several different impacts of all of this. Most importantly, the health of the community and of Americans is extremely worrying, I think, in its current state. But also on things like the upcoming election, on job opportunities, and very relevant for a lot of us here, like universities. The election being the most front and very much in our face issue, because it's coming up in just 3 months. The narrative of the Democratic National Convention and the Republican National Convention in the last week or two really highlights how different parties are going to position themselves once their platforms are more apparent. But I think regardless of your politics, whether you're liberal, conservative, and I think the Canadian scale of liberal and conservative is much more moderate than the US one, I think everyone kind of has to agree that the response can be done better. And there's really been a failure to not only test, but also just broadcast a public message that we need to address this with the severity that it deserves. We've seen President Trump in his interviews say that there's been too much testing, that if there were fewer tests, then there would be less cases discovered. And that's worrying, right? That's just very much anti-science and anti-statistics. People in general should be able to recognize that, but due to the politicization of this issue, a lot of people don't, or just choose to ignore it. Dr. Wong's charts that we just saw going through different variations of how to interpret the data and what's important and what's significant, he should really take that and explain that to the president, because we've seen in the latest Axios interviews, President Trump focused on the fatality percentage as the one thing that he really cared about. Of the people who are sick, how many actually resulted in death? And that's not the statistic that the public wants to focus on. The public wants to focus on cases as a percentage of population, because that's how we're measuring spread, or deaths as a percent of population, which the US is, we're hitting 180,000 deaths. Those are the statistics that are important, but they're not being broadcast as important statistics to the American people. From a public health perspective, that's challenging to deal with. And the White House coronavirus response team has been outspoken, but their role has been downplayed by the executive branch and the president's office, which most people there do not have health or medical background. So other issues that the coronavirus has impacted also tie into the election, one of them being job opportunities. In the US, we've seen unemployment rates and unemployment benefit applications hit 1 million per week. We've seen, everything other than the stock market plummet. And in the US, I think US politics really has a jobs first mentality. It's something that the Republican Party has always upplayed. And I hear this in narratives from my peers and previously from my classmates at Harvard Law School as well, that if the economy tanks as a result of the shutdown, then people will be hurt in a way that is actually more severe than the health crisis of the pandemic. The argument is that if businesses aren't open, then wages are lost. There's real impact, especially to minorities, to the economically disadvantaged. And as a result of that, people will die as an indirect result, or people will get sick, or people will fall below the poverty level as a result of that. So we should open up everything as fast as possible to avoid those consequences. Personally, I don't agree with that, and the research behind it is difficult to analyze because there isn't very much. But I think that the personal stories and the people on the front lines fighting this, their stories matter to me a lot more than the businesses that might shut down or the businesses that need to come back sometime down the road. I see them as indirect implications, and the call to open everything up in the middle of a pandemic to me seems counterintuitive. All of that has really trickled down to impact other things and to impact Asian Americans as well. I think one good example is the housing situation. Because people are unemployed, there's been a lot more housing evictions across the United States. And housing evictions of residences really highlight the disparity in wages, the wealth income gap in the United States. Some cities have implemented temporary moratoriums or have tried to cancel rent for the most disadvantaged people. But a lot of the evictions are also of businesses. Businesses like convenience stores, like restaurants, like dry cleaners. These are real people's livelihoods that have been impacted. And a lot of those are Asian Americans in the United States. We have friends whose families own restaurants that are undergoing tremendous stress right now, facing eviction from their landlords. And that's their families' livelihoods. That combined with some of the racism, the uptick in racism that we've seen, makes it really feel like an us against them scenario in some instances. But I don't think that racism is growing. I just think racism is much more apparent. People are able to speak their minds more publicly, speak openly, and a lot of that's captured on video, and we see that, and it's discouraging in that sense. Finally, the last area that I wanted to address is the impact on universities. and the impact on higher education. That's something that is very immediate to a lot of us. The United States has canceled classes for most universities or have done a mixture of online and in-person classes. Most spring classes were canceled. Fall is now virtual for most universities. Even if the dorms are open, classes, especially large classes, are not. Most social gatherings and extracurriculars have been canceled. Things like fraternity events, conferences, all of that is being postponed. The impact of that on the quality of education is very clear. It's not the same learning online. Anyone who's tried to learn through Zoom will tell you that. The discussions are not the same. The professors aren't able to relay the same level of knowledge or even just passion for the subjects. But the impact on lower income families is tremendous. A lot of this comes up when people need to go home and think about other responsibilities they have at home. I think many of us are very privileged to not have to worry about stuff like that, whether you have secure housing, whether you have high-speed internet, whether you have a place at home to study. People have to take care of siblings, family, parents. Some people have to go back and work in family restaurants, family businesses. The support that universities are able to give to lower income families is very limited. There have been, at Harvard, there were increases in loans, but no grants to help them even buy things like a webcam or to get a new computer that can run Zoom properly. Those kinds of things a lot of people don't think about, but for people whose parents are working multiple jobs and they are expected to go home and help with that because of layoffs and furloughs. Asian Americans, especially the Southeast Asian community, have been particularly impacted by that. The Asian American associations at Harvard have acknowledged that, and most have written statements to their members offering aid and support. We're not allowed to give monetary support, but support in terms of getting notes out to these students, for students who've had to go home due to visa issues, helping them record classes when the university hasn't done that, and just actually being there for each other through these times, very challenging times. Most recently, the Trump administration had also been attacking a lot of the different student and work visas in the States. So I don't know if any of the students here are looking to go to the US, either for university or for work, but they have restricted the number of, for example, H-1B visas. They've targeted China specifically for their international students and restricted both OPT and also F1 student visas. That was very worrisome for current students because a lot were worried that they couldn't come back into the country. Harvard, MIT, and a dozen other universities sued the Trump administration and the immigration agency to block the executive order through injunction, and successfully did so. So as of now, students are still able to enter the US from different countries, as long as you have legitimate papers documenting that you're taking classes there, etc. The biggest worry is still for work after graduating, because if Trump wins the election this year, he has promised to continue his assault on work visas for international students. That's something that is immediately and very directly relevant to Asian American students because we make up a significant chunk of the international student population. So I've been going around telling all my friends to go vote because our futures also depend on it, even though we are not eligible to vote. I think in conclusion, the response here has not been nearly as optimistic. And I see that on a daily basis. Midtown Manhattan is still completely empty. businesses are shut down, office towers are completely dark. The extent to which this will go on, I think, is very hard to predict because of the patchwork of different responses across the country. Even things like my bar exam for entry into the legal profession has been postponed and then canceled and reinstated. The SAT has moved all over the place. A lot of it just remains uncertain. So I think it's at least inspiring that people like yourselves are writing about it, are thinking about it critically. Whether you want to become a healthcare worker on the front lines, whether you want to shape policy through law, through business, as long as you pay attention to these kinds of issues, what's going on around you, I think we have at least a really good fighting chance up ahead. Thank you.
Thank you very much, Leo Ding. And that will conclude the scheduled talks for tonight. Thank you to Dr. Ehret for your very inspiring speech on Canadian-Chinese cooperation. Thank you to Dr. Wang for your informative speech on COVID-19's impact on Chinese Canadians. And thank you to Leo Ding for your very eye-opening speech on the depressing American perspective. I'd like to thank our distinguished guests once again for taking the time out of your day to speak to us and answer our questions. Now we will move on to the live Q&A hosted by Madison Wang. Feel free to add any questions you may have in the chat and be sure to put which speaker you are posing the question to. So over to you, Madison.
Thank you, Ethan, and thank you again to our speakers. And as Ethan mentioned, we'll now reserve 15 minutes for questions, so please put them in the chat and I'll direct them to our speakers.
I wonder if I could have permission to give a comment on Leo's talk.
Sure, of course. Go ahead.
Yeah, I appreciate it very much, Leo. I spent 8 years in Connecticut at Yale on staff, and so I had an appreciation of the differences between America and the United States. I left there 25 years ago to come to Toronto. When I left, I was interviewed by a CNN. And they asked, why would you go back to Canada where the wages are less and opportunities less? And they asked me what the problems were that I perceived in the United States that were more blatant or more obvious than in Canada. And 25 years ago, I said the issues are one of racism and inequity. That is, the wage gap between the rich and the poor is too great. And it's more so than it is in Canada. I'm not being smug about Canada, but racism is more blatant in the United States, for sure. And that's not to say it doesn't exist in Canada, because it does. But 25 years later, it's the same problems. And in fact, I would suggest that they're worse. So I really appreciated your perspective on that.
Thank you, Dr. Ehret. We now have some questions. So for Dr. Wang and Dr. Ehret, how did you overcome language and cultural barriers?
Okay, very good question. And probably as 2 parts. I believe this for me. I have been living in Canada for many years, and the language barriers, I still have a language barrier. As you know, I'm not a good speaker in somehow. And more importantly, as a university professor, the writing, still a problem, but my way to handle this in terms of writing, I often closely work with my colleagues and with my students. They work as a team, and each person has his own strengths and limitations. As a work as a group, we can make things move very smoothly. In terms of my culture part, initially, when I first came to Canada 30 years ago, for a very long time period, people, if you ask me whether you're Chinese or Canadian, sometimes in the past, I always say I'm the Chinese, still Chinese origin from, but if you the big distinction for me in the past, when I think about home, I often think about China as my home. But gradually, particularly for the past few years, I gradually become Canada is my real home. I live with it so long, and if I go back to China, stay there, each year, I travel back to China maybe 2 times, maybe 3 times, and even China is very familiar to me. I grew up there, and each time I go there, there's new to see so many new things. Sometimes still I feel unsettling, uneasy. Somehow you feel like this is probably not your home. But whenever I'm in Canada, I really feel I'm home. So gradual change. And the cultural part, and for me, in terms of, because I live in China, live in Canada for many years, sometimes I cannot tell the very, very distinction natures from 2 countries. I think in many parts, human beings are the same. And we are talking about the human culture. We are talking about the human beings' interactions. And then in this regard, we can have the good person, good people, some not very good people. And every country has both part. In this part, I don't think China is very different from Canada. And this is my personal experience. Yes, my feeling. It's not really scientific argument. It's my personal feeling. So I don't know if my understanding is correct. This is.
Thank you, Dr. Wang. Our next question is for Dr. Arid. When did you know you wanted to become a surgeon, and how?
Well, the initial reason in medical school, I decided to go, and I went to medical school, where Dr. Wang is from, in Memorial in Newfoundland. I actually wanted to become a doctor in a small town and coach the hockey team. That was what I ultimately wanted to do. But when I decided to work with blood vessels and then cardiac surgery, they're not available in small towns. I knew I wanted to be a surgeon because I didn't think I was smart enough to be another kind of doctor. And that's the truth.
Thank you, Dr.
So Dr. Arid, where did you grow up?
Well, my father was in the Air Force, so we moved around different parts.
Oh, really?
Canada.
Okay.
Yeah, and that was an advantage too in the retrospect. But you talked about learning new cultures. One of the other questions for me going to China, it was totally new culture, but it differs from different parts of China where you go. So, and I've never been able to master the language that I can speak fluently for sure. But and I've always got help. Well, I was always a translator. I enjoy the translators, but I agree with what was said. We're more alike than we are different. We all want our families to do well. We all want to pursue our own professions to the fullest extent, and that's not different in Canada or China or almost anywhere else in the world.
Thank you, Dr. Arid. Our next question is for Leo Ding. How did COVID impact the law side of things in the U.S.?
Sure. Once there was a point in March where everyone, I think, recognized how significant the challenges of this disease were and what the ramifications were. The law side of things really ground to a halt. And by that I mean, in practice, all the courts shut down, oral arguments were postponed, and everyone basically said that we're going to put off our decisions until sometime in the future. For New York State, that future is basically now. So in September, they will resume oral arguments for trials in court. The implication of that is pretty severe though, because imagine if you are in the process of whatever kind of dispute, whether it's contractual, whether you're being charged with a particular crime, to wait 6-7 months in limbo can be very difficult depending on your personal and your particular situation. And a lot of that is really, I think, highlighted by the situation in prisons. Prisoners have applied to the judges saying that the conditions in prison are inhumane because there's really no way to separate or social distance in a lot of the facilities in prison. So especially older prisoners and prisoners whose health are at risk have applied to the courts either for early release or for transfer. And that's what the trial courts are flooded with now. The judges are working day and night to process these kinds of cases, which are temporary, right? They don't resolve any particular issue. They don't move a case forward. And so as a result, the system is really overwhelmed because everything is going to be delayed and there's a much higher amount of work. On a more macro level, lawmakers, I think, have become more politically polarized. They've basically failed to arrive at a package that is able to address the problem. Yet that CARES Act I think as a Band-Aid solution, it provided a little bit of money to businesses, to people who filed their tax returns. But that's extremely temporary and won't last the length of this pandemic. So I think it's really highlighted a lot of the weaknesses structurally in the legal system here.
Thank you very much. Our next question is for any of our speakers. How do you feel about Canada and America's response plans for reopening schools? And is there anything you think that should be done that hasn't already been mentioned?
Yeah, if I do, I want to make some comments because I often communicate with my friends and also my university mates in the United States. I often use Canada as a good example and hope United States will follow us, but very unlikely. In terms of Canada, Canadian government initially reaction a little slow, and it looks like they did not realize the severity of this outbreak at that time. And for example, masks and social distancing, they put their, I believe, put the political part first, and they need to maybe think about marriage. That's good, for the Chinese community. For example, politicians came out to support Chinese restaurants, to support Chinese business. At that time, I can tell you, I was very concerned. In fact, I was invited to this occasion, I refused, but I did not want to make an open comment because in my heart, I knew they intended to support us. I'm one of the us. So, but on the other hand, from pandemic, from our outbreak part of view, this is not good. They need to be very vigilant. But as soon as we realize the severity, as long as we realize other places already started, the Canadian government took very swift action. From that time on, there's one thing I want to say. Another thing, at this time, I was very impressed. But the Canadian government, the different parties across the line, across the walls, across the borders, they built a bridge. Different parties communicate efficiently. As you remember, Doug Ford praised the federal government. Doug Ford is the Conservative Party and the Liberal Party around this country. And the different parties work together. Also, there's number two, the three-level governments work together. Federal, provincial, city levels, they all work together. This is that's very, very impressive. And another thing I want to say, and the cooperation among the Canadians is extremely good. I would say the Chinese population, Chinese Canadians in particular, basically they just follow the guidance from the officials, from corresponding public health officers. So in Israel, in the United States, is simply one word to say the disaster. Couldn't, yeah, you can imagine whoever in that position, in Trump's position, US could not be this bad. And it looks like no immediate hope. And, you know, so we don't have control of the election. Even looks like Trump may be re-elected. This still possibility is still there. And I'm really very, very concerned with the United States. And for the group here, I believe in one way or another, all of us have some connections with the United States because two countries are very close. For example, my son is in the United States. He's doing his research there. And his plan, he plans to stay in China, in the United States, if Donald Trump is re-elected, I think he will come back to Canada. So I would agree. I think the whole environment, particularly for the minorities, and for researchers, going to get worse. Okay, this is my brief comment.
Thank you, Dr. Wang. I think we have time for one more question. So our final question is for Dr. Arrett. Do you work with pre-med students in local initiatives and research or clinical opportunities?
Answer is short, yes, I do.
All right, thank you then. I'll now hand it over to Ethan for awards.
Thank you, Madison, for hosting that Q&A session. So an additional note, any unanswered questions we will save and later post on the ANIA website, so be sure to check that later. Now we will move on to the award ceremony. It was a difficult decision with plenty of amazing personal essays and research proposals to choose from. Once again, thank you to the Bethune Medical Development Association of Canada and the Center for New Immigrant Wellbeing for sponsoring our prizes. A special thank you to CNIW and the judges for spending their time to review each submission in detail. Now, I'd like to invite Professor Wang from CNIW to speak a bit on the review board and how the judging process went.
Okay, Ethan, thank you very much. Okay, you know, each of you, I want to thank you all the contributors for your time, for your efforts, and you produce excellent work. And this our privilege to review your work, because you put so much time on that, and you produce such wonderful work. We treated your contribution seriously. As a result, we set up a committee to review our, we call the review board. The CNIW Center for New Immigrant is in charge of this. We reached out to reviewers. As a result, we assembled 16 people. This table here shows the name, the Chinese name, English name, their qualifications, the degrees, the area. So not many people can go very quickly. Ying Cao, Helen Cao, who is a computer, she has a computer degree, and also she's CFA, Chartered Financial Analyst. And she has been here for 30 years in Canada. She's truly bilingual, and also she runs some kind of education program. It's very relevant. The second person, who is doctor, also professor, received his PhD at the University of Toronto. And the third person is Han Xiao. Han Xiao received her PhD degree, also University of Toronto. And her English and Chinese are both very good, and her writing is very good. This is her. This one is Kong Yujia, who is Chinese scholar, staying in Canada. In fact, she's working with me from Shandong province. She received her PhD in epidemiology and biostatistics, and the lecture in her own province, Shandong province. Next person is Qiang Beiping, who is medical degree. In fact, who used to be a cardiologist in China. He came to Canada roughly 20 years ago. In addition to his medical field, he's very good. I cannot say also very good. He's very productive author. She produced 3 books, novels, 3 novels, and he also a poet. His both English and Chinese are very good. This one is all CNIW member, CNIW, who is registered the dietitian, RD we call it. The person also PhD in biostats in IP. This one, Dr. Fang Li Xie, who is epidemiologist in Durham region. This is myself, and this is another person. And this person, I'm very glad she make contribution to she's legally blind. She cannot read. I checked with her whether you can do this. She said, yeah, she can. Basically, she listened to all the work, and she has some device to listen this based on that. And yeah, I don't know if she's here or not. That's Dr. Li Xiayang, who is professor of psychology at the Ryerson University, Yuanzhou. You all know that. Dr. Yuanzhou, all know him. Another Dr. Zhang, and who also has PhD degree. This person is special. Dr. Wei Hong Zhang, who is a professor in epidemiology. This person is not in Canada, in Belgium. Yeah, we have the correspondent. I sent the email to her, the check with her whether she wants to be a reviewer. She reviewed 3 pieces of work. So there's another person, Dr. Yun Zhu, who also she's associate professor at Tianjin Medical University. She lived in Canada for roughly 10 years. This is the committee member. So I can tell you, they are very qualified to review your work. This is part 1. And the second thing I want to say, in order to make fair judgment, to reduce any possible bias, avoid any possible conflict of interest, we did blinded review. Basically, before Cindy has done lots of work, before we send the article to each reviewer, we removed the names, any some identifier. So make sure they would not know who was the contributor at that. This is second part I want to say. And also, when doing this kind of thing, it's inevitable have individual variation. Some people have a tendency to give a high mark, and some people have a tendency to give a low mark. And if one writing sent it to a person with tends to give 1 mark, the high mark, this person have some kind of advantage. Vice versa. Try to avoid this kind of problem. Cannot 100% avoid it, but we have done our best. Each piece of work has been evaluated by at least 3 people. So if there's some kind of tendency, high, low, in terms of grading, at least some of the effect would be ameliorated, not eliminated, I would not say that. So this is basically, this is a review process. I have to say, given the very short time interval, only have few days, I believe 2 days or 3 days. So I had to reach out, have to arrange the time. So they send out their score, and some of them send comments, some not. But the comments were not a requirement, because if you ask people to write comments, going to probably requirement too high. They want to spend more time on that, given the short time period. So we did not ask them to write comments. So this is brief update, brief report for the review process for the review committee.
Okay, thank you, Dr. Wang. Now we shall proceed to announcing the academic awards. Before we announce the top winners, Alina Yu will announce the honorable mentions for the academic pieces.
Thank you. We would like to acknowledge and thank our participants for receiving an honorable mention award in academic writing. Gitanjali Raghava for her piece, Is the negative behavior among people during quarantine only a result of isolation or mostly because of the increase in social media use? Wei Jiadong for the piece, How serious is COVID-19? Kitty Chan for her piece, How does materialism affect the life satisfaction of Americans? And Emily Singh for her piece, Life in Quarantine, Detrimental or Beneficial? We'd like to present them each with a $40 prize.
Thank you, Alina. Now I'd like to invite Professor Wang to present the academic prizes.
Okay, thank you. I also made a slide. Let me see, close this one, stop this one. And sorry. Yeah, this one. I want to share this one. Prize committee, and I'll have this. So we go with the third prize, impact of social isolation during pandemic among disadvantaged and vulnerable groups. The winner, Lucy Chi. Right. Congratulations. Yeah. Okay, good. So the second prize, exploring psychological impacts of anti-Asian stigma and compliance during the COVID-19 pandemic. This is a group of contributors. So the name here, Alice Yu and Amy A. Lee. And I don't know how to pronounce this last name. Anyhow, the name is there again. Congratulations. Yeah, congratulations. I believe if I remember correctly, the second prize is $100. So I don't remember the third one, but slightly lower than this. And the first one, the effect of social closure on learning among Asian and non-Asian community teens. Contributor, Emily Zhang. And because it's a winner, I copied her abstract here. So I was very impressed by the piece of work. She has her research hypothesis. If she collected data, she made a comparison, produced result. The report is nicely done. And this can be, if she continues to work on this very likely would be a publishable piece of work. And this is winners. Before I leave, I want to share a piece of information. The CNIW intend to work with the research team, my research team. Before long, we are going to conduct another survey. It's not academic survey, but very close. We are going to survey young students, and Asian student or Chinese student, in terms of the impact on them, and also some particularly on international students. Some international students continue to stay in Canada. Many of them have already returned to China, and we want to know what kind of impact they have, and how this pandemic affect their future plan, and what the challenges they have. And because your work, and not just Emily's work, other people very close to us. And if you want to know more information, I'm happy to share with you through, you can send me email or something. And this, currently we are in the planning stage, and we have some kind of limited funding to support this, and looking forward to your involvement. Thank you. This is Ward.
Thank you, Professor Wang. And congratulations to everybody. Once again, thank you to CNIW for sponsoring the academic awards. Now we shall proceed to announcing the personal essay awards. Once again, Alina will announce the honorable mentions for the personal essay pieces.
Thank you. We would like to acknowledge and thank our participants receiving an honorable mention award in personal essay writing. Gitanjali Raghava for her piece, The Grocery Store is Now My Haven. Wendy Wang for her piece, The Ups and Downs and More Ups of COVID-19. Ella Lee for her piece, Break or Breakthrough. Melanie Wang for her piece, A Pandemic, Effect on Asian North American Communities. Yingzhe Wang for the piece, On the Mask on the face mask wearing during the COVID-19 pandemic, Lucy Chi for her piece Light in the Darkness, Jane Ling for her piece The Comforts of Quarantine, and our anonymous submission, Asian Discipline and the Importance of Touch. We'd like to present them each with a $20 prize.
Thank you, Alina. Now I'd like to invite Dr. Lee Errett to present the prizes to the winners of the personal essay pieces.
Okay, the third place goes to Allison Wu. Third place award also presented to Samara Kudagunti, I hope that's correct, and another award to Edwin Jiang. Second place of $50 to Tina Wu, Joy Giao, and that's it for second place, $250. Too Close to Home for Jessica Yu was awarded the first place and receives a prize of $100.
Thank you, Dr. Errett. And once again, congratulations to everybody who submitted and won a prize. Thank you to BMDAC for sponsoring the Personal Essay Awards. Now we shall proceed to announcing the Mandarin Submission Awards presented by Dr. Yuan Zhou. By the way, Yuan Zhou, you are muted, so be sure to unmute.
Okay. All right. 我用中文了。这是我们的第3等奖，3等奖是给艾米肖，他的文章是浅谈 COVID-19 对北美亚裔之影响。恭喜艾米肖。现在宣布，我们中文写作的2等奖。2等奖给予包内样，他的论文题目是 Who am I？ 破局疫情下香蕉一代的身份围城。恭喜包内。1等奖100块钱给予孙博，孙博的他的文章是这比病毒更可怕。恭喜孙博。
Thank you, Dr. Zhou. Thank you to BMDAC for sponsoring the Mandarin Peace Awards, and congratulations to all the winners. All the winners tonight will have a chance for their essays to be published on cniw.org as well as the ANIA website. Once again, thank you to everybody who submitted. We thoroughly enjoyed reading your insightful writing and innovative ideas. Your certificates will be sent via email alongside your prize money or honorable mention award prize. Once again, I'd like to thank our guest speakers for speaking to us and answering our questions this evening. And a big thank you goes to our generous co-organizers, sponsors, and the Media Global Chinese TV for sponsoring the ANIA initiative. Now we will have a few closing remarks made by Dr. Yuan Zhou. Dr. Zhou graduated from Shandong Medical University and later received his PhD from the National University of Singapore. He worked in Singapore General Hospital and later did his postdoctorate at the University of Toronto. He is currently working as a cardiovascular perfusionist at St. Michael's Hospital. He is the co-founder and executive vice president of the Bethune Medical Development Association of Canada and has been actively involved in medical exchange programs between Canada and China. Take it away, Doctor.
Okay, thank you. Good evening, ladies and gentlemen. What a wonderful event. First of all, I would like to take this opportunity to congratulate those winners in the essay competition. Congratulations for your winning the prize. Also, I'd like to thank all of students who attend this event. Your involvement and hard working has also been recognized. The paper you wrote are very inspiring and impressive as well, but only not lucky enough. Secondly, thanks for our 3 invited speakers, Dr. Eric, Professor Wang, and Mr. Ding. Your speech are excellent. Last but not least, I would like to express my appreciation to members of organization committees, our article reviewers, volunteers, and the 9 organizations. Thank you all for your support. Among those, I would like to specifically mention about 3 individuals. They are Li Fei Qu, Qu Lifei, Helen Cao, Cao Ying, and Sandy Xin, Xin Qing. They are most important 3 ladies. Without their hard working and efforts, the IC competition could not be happened. Okay, let's talk about the initiative of this IC competition. We all understand that the primary role of young people is to get good education in order to become better citizens of tomorrow. It depends on you guys for the entire success of the nation's future. Since the COVID-19 pandemic, almost everything has been shut down, including university and the schools. It's really big wastage of human resources if young students are not given an opportunity to exercise and practice their talent. Not only that, by facing pandemic every day, just like what you guys describe in your papers. I'm tired, I'm stressed, I'm scared. I don't know who I am, and I have no answer. How am I, etc. With all those questions and confusions, we are launching this essay competition. From all your papers, we know you guys are really smart and have done a lot for this work. For example, now please listen carefully. Most of the term is from you guys, not from me. To prepare the papers, you guys have to read about how serious is COVID-19. Whose paper of this? And how COVID changed my life. To prepare the papers, you guys have to think about the tipping points of research against the Asian, and think about a pandemic effect on Asian North America community. Furthermore, think about who I am, 香蕉一代的身份围城. To prepare all those papers, you guys have to understand the glossary store is now my heaven, and Asian discipline and the importance of touch, and understand break and breakthrough. To prepare the papers, you guys have to analyze life in the quarantine, good or bad, and also comparing the impact of online and the in-person classes. To prepare the paper, you guys have to discuss about negative behavior among people during quarantine. Discuss about life in the quarantine. Discuss about on the face mask wearing during COVID-19 and 浅谈 COVID-19 对北美亚裔之影响。By writing these papers, you guys can share your story about your own life, such as too close to home, soup dumpling and summer, the ups and the downs, too much time, light in the darkness, and 这比病毒更可怕。Moreover, we received 8 academic articles, which I think are very challenging for your students, young students. I would like to leave the judgment for those papers to Professor Wang. Hopefully, you guys are able to get some financial support from Professor Wang. He is not only knowledgeable, but now he is very rich. Again, congratulations to all the winners. Also, thanks again for all students attend this competition. All of you guys are very talented. Your parents and teachers should be very much proud of you guys. Remember that. Keep on doing good work. You young guys are morning in the day, spring in a year, and you guys are future of the country and of the world. Thank you and have a good night. Thank you.
Thank you very much, Dr. Zhou. We received a message from CNIW that Cindy has an announcement to make regarding a correction on the academic awards. So I'll let Cindy talk about that for now. Also, by the way, Cindy, you are muted, so please be sure to unmute.
Okay. So there are 2 pieces who got 3rd place. Can we show the certificate, Jessica?
I'm sorry, this was my fault because I was busy in preparing my slides. I did not receive the certificates until last minute. Somehow I was not able to show it. This certificate needs to be shown. Also, there are 2 winners for 3rd prize.
Yeah, so Professor Wang, do you want to
okay, sure.
Yeah, announce it again. Yeah.
For the 3rd prize, we have 2 co-winners. Winner number 1, Lucy Qi. Number 2, Amy Lee. Congratulations.
Thank you, Dr. Wang and Cindy, for updating us with the new prizes. And once again, congratulations to everyone who won. So now I want to thank the amazing Anaya team for their hard work and dedication to making this event possible. I would like to thank Jessica Yu, Lina Zhuge, Colleen Chang, Lorraine Wang, and Kathy Liu on the design team for making the beautiful logos and posters. Thank you to Amy Lee, Madison Wang, Reese Chu, Madeline Ning, Allison Wu, and Joey Chow on the marketing team for spreading the word and allowing us to attract so many submissions. Thank you to Alina Yu, Gitanjali Rangava, Wendy Wang, Vivian Zhang, and Raul Yates on the submissions team for collecting and organizing these submissions. Thank you to Adrian Wei for organizing our Discord activities. Thank you to the main organizers, Jessica Yu, Alina Yu, Amy Lee, Lina Zhuge, and Madison Wang for their impeccable organization and for helping us make this whole initiative a reality. Thank you to all the parents for supporting us throughout the initiative. Thank you to myself for organizing this webinar. Lastly, thank you to everybody here for coming this evening and supporting the initiative. We apologize that it went slightly over time, but we greatly appreciate your support, and we hope you've had a very educational and enjoyable evening. Let's have one round of applause for everybody.
Thank you.
Thank you all.
Yeah.
Now, does anyone have any very last remarks before we conclude for the night?
I just want everyone turn the video on. I can take a group picture through screenshot.
Yeah.
That's a good idea?
Yeah.
Okay, that's good. Yeah. Okay, just give me a second. Yes.
I'll take like this.
Okay, good. I did.
Good.
Yeah, that's good. And thank you.
So you took the picture, Dr. Wang?
Yeah. Okay, I take one more. Yeah, take one more.
Oh.
I use screenshot. Yeah. Okay. Okay. Yeah, because we are going to use this picture for our news article. Yeah. Good.
Okay.
Yeah, finished.